Hi everybody, in this video we're gonna talk a bit about low back pain as an example of a potentially chronic pain condition. And I'm just gonna briefly describe the problem to you so that you know what it's all about, and then very quickly I'm gonna run through a study that I myself did for my PhD. Okay? So, low back pain is just pain in the lumbar area. Okay? And in most cases, it's episodic. So, you have an acute episode of low back pain that goes away after a while, like a couple of days in most cases. And if you're lucky, it doesn't go back, or it comes back after some quite some time. Okay, and a lot of people have these acute low back pain episodes, but in some cases, it gets chronic, and more on that later. And the underlying cause is not identified in most cases, either because these people don't get they don't even report to primary care, or if they do, uh, the physicians just say that it's okay, it'll go away on its own after a while. The pain is believed to, in these cases, it is believed that is due to some sort of mechanical problems like like joint strains or muscle strains or things like that. And we also have what's called red flags that signal potentially serious conditions such as bone cancer. And these are unexplained weight loss, fever, significant problems with feeling or movement. This is what you need to watch out for. And in some low back pain, it's caused by damage to vertebral discs, and you can use a straight leg test to see if that's the case. And the straight leg raise test is just when a patient's lying down, and you ask the patient to raise up a straight leg, and you probably learned that in neurology or someplace else. And if you have chronic low back pain, that's probably because of some sort of a pain processing system malfunction, as we talked about during our previous classes. And it's either because there's some central problem with your pain processing that produces a constant chronic pain without any trauma, or like a physiological cause, or the physiological cause is there but it's kind of amplified and kind of magnified by the disturbances in pain processing. All right. And what most physicians do is they prescribe some form of NSAIDs, and this there are various opinions on that, whether you should do it or not. And I'm no physician, I'm not going to advise you on this. Either way, just note that it's a bit of a controversial thing. And yeah, whether these are NSAIDs or paracetamol or any type of pharmacological treatment for a acute episode of low back pain, there are proponents of this. And there are also some people that say that it has no obvious benefits aside from like a placebo effect or something like that. Um, and I don't know. I can tell you from my own personal experience that I had 3 or 4 episodes of acute low back pain in my life, and I took diclofenac for them, and the pain was a bit smaller, but it was still very disabling and very intense for a couple of days, and then it went away on its own. So, uh, you know, uh, I guess it's a difficult thing, right? Whether you should prescribe pharmacology for this or not. Either way, what's kind of agreed upon is that normal activity should be continued as much as possible during the pain episode, so that no avoidance of activity happens afterwards. And this is what we covered when we talked about fear avoidance model. And what you should do is you should encourage your patients to remain active even though they are in pain. It seems that in most cases you cannot get hurt more if you remain active with low back pain. But of course, there are episodes and there are patients who are just completely disabled and cannot get out of the bed because of how intense the pain is. So it also depends on the patient whether or not the intensity allows for activity. Okay. And medications are recommended for the duration that they're helpful. So if something is helpful, then it's okay. If it's not, then it's not okay, and that's it. And I'm sorry that this is so inconcrete, but the one of the problems with low back pain is that there is no obvious treatment that's working in most cases. And what's also important to recognize is that low back pain often affects mood, and the mood may be improved through counseling, through various forms of psychotherapy or antidepressants for that matter. And that's why in some cases antidepressants work to alleviate the pain and improve the patient's condition. Because of from what we know at least, it's not about the direct influence on pain processing. Rather, it's because antidepressants kind of make you feel less negative, right? Because it's not feeling happy. It's in most cases people report that they're feeling less unhappy, right? And this helps with the management of the vicious circle that we talked about before. All right. So what is the scale of the problem? The problem is immense. Approximately 9 to 12% of people have low back pain at any given point in time, and this is even more in developed countries. All right. I'm not sure why is that. There are a couple of theories. Most of them have to do with diagnostics, really, because people in less developed countries have more, they have poor access to healthcare, and they report to healthcare with more, let's say, quote unquote important matters. But then maybe that's not only that's not the only case. Maybe physical activity plays a role, and lifestyle factors and so on and so forth. But there's no consensus on this. And just to give you an idea of how many people are affected, 9 to 12% of all people equals roughly about 600 million, right? So it's a lot of people, okay? And nearly 25% report having it at some point over any 1 month period. And about 40% of people have low back pain at some point in their lives, with estimates as high as 80% among people in the developed world. So it's a very, very widespread thing. Chances are that even if you did not have a low back pain episode before, you're gonna have it afterwards sometime in your life, okay? And the problems most often begin between 20 and 40 years of age, but there's a growing amount of low back pain in adolescence as well, which is kind of, disturbing if you think about it. And these figures grow. We have some longitudinal data from the last 10 or 20 years, and it seems that the percent of people suffering from low back pain, the percent is growing with each year. Okay? And men and women are equally affected. So what you need to know is that low back pain is one of the leading causes of disability worldwide, And I don't know if you're familiar with this study, the Global Burden of Disease study. It's one of the most, the biggest and most significant epidemiological studies. That's you know it's a worldwide study. From what I gather, it's I think it's sponsored by the World Health Organization, and the purpose of this study is to determine how much burden the various diseases make on different populations. And one way to measure this is using the metric called years lived with disability. So YLD means years lived with disability, and the idea is that you try to calculate the lifespan, like an average lifespan of a healthy person in a given population. And this of course varies depending on where you are, but the idea is to think about how long people live if they remain healthy throughout most of their lives, and in most cases it's about 80 or 90 years old. From that number, from 80 or 90, you use it like as a benchmark, and every disease that leads to either premature death or leads to a significant period of disability counts towards those years lived with disability. I mean, sorry, not premature death, but only years lived with disability. And from all the diseases in the entire world, low back pain produces the highest lived with disability score. And so it's higher than cardiovascular disorders. It's higher than cancer. It's even higher than psychiatric disorders, which are notorious for the amounts of disabilities that they produce. But not a lot of people know that. Well, mainly because you cannot die out of low back pain. So it's not that well publicized, but the amount of problems and the costs of that problem is really immense, and it's estimated at 100 billion US dollars in the US alone yearly. And these costs are hidden in loss of productivity due to low back pain. And as I said before, in most cases, an acute episode of low back pain ends after a couple of days, but there are some patients that develop a chronic condition, and according to various sources, this is between 10 to 30% of cases. I'm not sure how accurate is that, and more on that just a bit later. We don't know the exact mechanism for this. So a couple of things have been suspected, from things like pain-prone personalities back in the day, through various behavioral factors, psychological factors, such as the development of this vicious circle that we talked about when we talked about fear avoidance models. And one of the recent developments has to do with functional MRI studies. There's one study that claims to have predicted chronic low back pain in an inception cohort of acute low back pain patients using functional MRI. I'm not sure how accurate is that, because that's just one study. But then these mechanisms are, I would say, probably they probably have to do with pretty much the way your brain works, and various problems that are on the level of central nervous system. So now I just wanted to briefly tell you about the study that I did for my PhD thesis. The aim was to look at the psychosocial predictors of chronification 3 months after an acute low back pain episode in an emergency department patient cohort. So, and by the way, I was trying also to determine the predictors of the length of sick leave in these patients. It was a prospective cohort study. So the idea was to recruit as many people with acute low back pain as we can, and then follow them up after 3 months and see to see whether they developed a chronic pain condition or not. And mm, who was recruited for the study? Well, these were the patients of the emergency department of our university hospital here, that had non-specific low back pain, and they were free from pain for at least 3 months before the study. So what was important was to recruit people who have a new episode of low back pain. And they were between 18 to 65 years, and they read and wrote in Polish to fill out their questionnaires. If the cause of pain was suspected or known, they were excluded. Pregnant women were excluded, and other serious illnesses as well, such as cancer and whatnot. And what we did here was, in phase one, we gave patients a battery of questionnaires at admission, and then after 3 months, we conducted a structured interview, just to see whether or not they developed a chronic pain condition, and how much time did they spend on their sick leaves. And we use a couple of methods. Brief pain inventory, this is what I told you before. I showed you that before. We also use this questionnaire for disability and low back pain. We use the hospital anxiety and depression scale, which is for measuring anxiety and depression. And we evaluate the locus of control, and to say here, pain coping strategies as well. And I won't go into details of that, but just that. Well, my idea is to just show you how these studies are being done. Okay, so what is our the source? What are our sources of information when it comes to these types of problems? So. Oh yeah, and this is coping strategies questionnaire, and also what's important, we asked patients to evaluate their health on a self-rated 5-point Likert scale from very bad to very good, and we gathered some social demographical data as well. And in phase two, there was a structured interview where we're asking about whether or not the patient feels pain, and the amount of sick leave that he or she received for the pain. We recruited 110 participants, 49 of them were female, and only 13 were lost to follow-up, so that's a good percentage. They were aged between, I would say mostly between 30 and 50, and they mostly had either university degrees or a higher education, and mostly living in a urban area of Tri-City, probably. Had a steady job that was, non-physical job in nature. And they were a bit, in general, they were a bit overweight. Average BMI score was 27. But then no significant correlations were found between BMI and either pain or sick leave or anything like that. Okay, maybe I'll skip that. You're not interested in statistics, probably. Or maybe you are. Okay, so if you want to compare means in this setting, you'll just use a Welch's test, probably. And if you want to do correlations, you just use Pearson's correlations if you can. And I guess that it's a big enough sample to warrant parametric statistics. And what's also important in these types of studies is to use multivariate analysis as well. So the point here is to evaluate the predictive value of different factors in not separately, but like taken together. So then you can pretty much say that you can predict whether or not something is predictive of low back pain after 3 months, irrespective of the values of other variables. So that's important. Okay. And you use linear. We use linear regression because when we try to model the amount of sick leave, the length of sick leave, because it's a continuous variable, and since the presence of pain is a binary variable, we use logistic regression, of course. Okay, and what was probably the most surprising result of them all is that 70% of patients had pain after 3 months. And the reasons are, debatable. I would say that one of the most obvious reasons for me is the way the question was phrased, and the question was phrased whether or not you feel any pain in your back right now. So a lot of people during those phone interviews said that, well, it's not that big, but it's there, right? So it's I would say that in a lot of cases, what remained was like leftover pain of sorts, or people felt low back pain, but it was not that disabling for them. Yet, of course, in a lot of cases, it seemed that it transferred to this chronic, debilitating state. So that's one thing to consider. Another thing to consider is that these were emergency department patients, and in all honesty, if you have if you present to an emergency department, you have very intense pain in most cases. So I would say that the pain intensity was probably higher than your average pain intensity of a acute low back pain episode. And these were objectively, I would say that these were a bit higher. I don't have it here, but from what I remember, these were about 7 on the NRS scale on average. So 7 is quite a big number, really, statistically. And these people on average were 28 days on sick leave. So that's just showing you how long how the scale of the problem, let's say. And what our main result is that it seems that this very simple variable called self-rated health, so please judge your overall state of your health from 1 very bad to 5 very good. This was you could predict whether or not somebody had chronic pain after 3 months using this measurement on admission. Okay, and as you see here, I'm sorry for the Polish labels, but this is the group with no back pain after 3 months, and this is the group with back pain after 3 months. And you can see that the group that was feeling pain had significantly lower self-rated health, which is here on the vertical axis. They had significantly lower self-rated health than the group who did not. And the effect size was about minus 0.5, so that's maybe not tremendously high, but it can be said that it's high. Okay, next up, disability, and here we looked into the correlation between the length of sick leave and disability, and the higher you had the higher disability on admission, the longer it took for you to come out of sick leave. And there are a lot of dots here because this is the 3 month period. So these people were still on sick leave while we made the measurement. And again, you can predict that using disability scores on admission. And the same pattern with anxiety. The more anxious you are, the longer your sick leave's gonna be, pretty much. And the same thing goes with depression. So the more depressed you are, the longer you stay on sick leave. And pain interference. Remember, these are all on admission, so we can actually predict the amount of sick leave using these variables. So whether or not it's depression, anxiety, pain interference, or whatnot. Okay? And in general, in conclusion, you could say that lower self-rated health predicted pain chronification, and longer sick leave was predicted by lower self-rated health as well as higher pain interference. This variable locus of control, if you have internal locus of control, so you think that you are in charge of what's happening to you, and turning attention away from pain and less frequent reevaluating of pain. These are two coping strategies that I did not discuss before, and that's maybe these effects are not that strong, so that's maybe of less concern to you. But I guess that the primary outcome of this study is this: the lower self-rated health can predict pain chronification in patients with low back pain. Okay. All right, that's it from me, and stay safe, stay healthy, and see you guys. Bye.